here on TV 18. Don't forget, there is much more to our station than this morning show. You can check us out at grandcountytelevision.com. Information, news, weather, all sorts of things, and some fun movies every night. We are part of Outside Television, so lots of things you can do, streaming live, all things. So again, grandcountytelevision.com. See me in the morning and see lots of other people all throughout the day. So we're here with Jeannie talking about healthcare, and tell me, so going from a nurse, you see the needs that people have in the medical field, and then how do you feel like you got involved in healthcare and politics and what that kind of looks like?
It's hard for me to say that there was a time that I stopped being a nurse and I started getting involved in politics. I have always been in politics because I grew up in it. And so I have never seen my profession separate from politics. The political world has always affected the world of healthcare provision. And so to me, they are totally interrelated. It's not like I went from one to the other. It's like they were combined for me from the very beginning. And that's probably because of the way I was raised, that I always understood that the policies that were made affected not only my nursing practice, but also my patients, and whether they could get care, whether they could afford care, whether they could get care in a timely fashion. So one of my first experiences when I was a young nurse, I was probably 22 at the time, was working at the Gunnison Hospital. And I went down to the state capitol in Denver and testified because I thought that rural hospitals needed more resources to take care of patients. And I told this Senate committee that in this rural hospital, we didn't have the money for electronic systems for notifying the nurse when the nurse was needed in a patient's room. You know the little bell that they put on a counter at an auto parts store if the guys are in the back room and aren't there to wait on you at the counter? That's what the patients were contacting us with. And I said, you know, we need some resources. So in my opinion, I've never separated those two out.
So then going into the Senate, tell me some accomplishments kind of within healthcare, and that being kind of your number one focus, and what that was like for you for those 4 years.
So what I need to be clear about was that before I was in the Senate, I was a county commissioner for 8 years in Gilpin County. So that had broadened my interest and my expertise in a number of political issues beyond healthcare. So when I went into the Senate, I was also concerned about wildfire mitigation and all kinds of issues having to do with forest health, because I was representing a county that was at risk for wildfires, and certainly Grand County was also at risk for wildfires and part of my Senate district. So I was advocating for not only the traditional healthcare kinds of resources that were needed by the people, but all kinds of issues that were important to citizens in my particular district.
And Colorado is so different throughout all of the state that it needs to be focused on that. So in the Senate, tell me kind of what was accomplished throughout your time, and now coming out of it, you know, what you're still trying to move forward.
Okay. One of the bills of 68 that I sponsored that were actually signed by the governor during that 4-year period was to expand oral health services for people who were on Medicaid, because people on Medicaid, lower income individuals in our state, would have horrible problems in terms of their oral health and couldn't get access to care, and that would affect their general health. And I thought, as a nurse, that it made perfect sense for us to make sure that adults had good oral health care, even people who couldn't afford to pay for a dentist out of pocket. One of the important things that I learned in my research was that if women, during the time that they're expecting a child and right afterwards, don't get good oral health care, they carry a certain bacteria in their mouth, and it's called lactobacillus. And if they transmit that to the baby during, particularly during breastfeeding, but just in general, taking care of this new infant. The formation of the baby's teeth is abnormal, and that we were paying over $1 million to pull all the teeth of 2- and 3-year-olds
oh my gosh.
at Children's Hospital. And that was something that could have been completely prevented
if the mother had
if that mother had had good oral
oral
health care. Exactly.
How interesting.
So there were several bills like that that
Yeah.
I carried that had to do with making sure that people had access to good health care in order to make sure they were healthy and their children were healthy, and also that we would be saving money because we were wasting money on something that was totally preventable.
Right. And healthcare is such a, I mean, we can talk a lot about different things and for hours and hours and hours, but in where this is going is that something is not working correctly in our healthcare in America, and that people are looking at changes and what can be changed, and Colorado is one of those states that is looking at that. Had you always thought healthcare in America was not working properly, or do you feel like you benefited from it working and it was okay, and then you saw other people and it was like, oh, okay, yeah, this isn't working well? Does that make sense?
When I was growing up, I don't think that I realized that some people couldn't get health care, but as a young nurse, I did know that some people could get health care when they needed it, and that they could afford to pay for it, but other people could not. And over a period of the 50 years that I've been licensed to practice nursing in Colorado, what I've seen is a major shift where it has become much more difficult for people to afford health care. And the shift has been that the patient is no longer the priority, profits are the priority. And when that shift happened over that 50-year period, it left more and more people without any coverage. So let me just tell you a couple stories. When I was in Gunnison, we never asked people, when I was a young nurse, we never asked them, how are you going to pay for your care when they came to the hospital? We asked them, what's wrong? How can we help?
Why are you at the hospital?
Yes, exactly. What do you need? How can we help you? Now, that's one of the first questions that people ask is, how are you going to pay for your care? And then we'll decide whether you can get care. And more recently, I was at my doctor's office. This was about 4 years ago, and I broke out in hives because I had an allergic reaction to the penicillin that I'd been prescribed. And I walked up to the counter of the doctor's office and I said, I'm Jeanne Nicholson and I'm going into anaphylactic shock. And the woman behind the desk said, that'll be a $20 copay. Shift.
So all about the profit, all about how much the stockholders can make money, and what that looks like, and you're going to die, but that's
but you didn't pay for care. Exactly.
Interesting. So much to talk about. We're going to take another quick break. We'll be back here on TV 18 talking about how we can fix it. What is the state involvement? What should the state involvement be versus federal involvement, and where we can go in the future. So we'll be back here on TV 18.